The quality of the food we eat, or the lack of it, has a profound effect on attention deficit disorder and ADHD. For many people, nutrition alone can work effectively as an alternative treatment for ADHD. A growing body of research points to nutritional deficiencies, especially with essential fatty acids and amino acids, as a contributing factor to attention deficit disorder and learning deficiencies. Leave the Ritalin bottle for a minute to consider these nutritional research findings of attention deficit disorder with ADHD. A study from George Washington University School of Medicine found that hyperactive children who ate a protein-rich meal performed equally well, and sometimes better, at school than non-hyperactive children. A study from the University of Oxford, England, evaluated the effects of fatty acid supplementation in children with average intelligence, with significant reading and writing disabilities. ADHD symptoms in children receiving essential fatty acids improved significantly compared to children in the control group who received a placebo. The researchers first linked ADHD with attention deficit disorder with lower essential fatty acids in 1981. Studies that examined blood levels of essential fatty acid in children with behavioral problems in 1983 confirmed this nutritional connection of deficit disorder of attention. The researchers further documented the relationship of essential fatty acid deficiency with attention deficit disorder in a 1987 study. Then, a 1995 study comparing essential fatty acid levels in children with ADHD with a control group of children without ADHD found significantly lower levels of omega-3 fatty acids. In 1996, researchers at Purdue University discovered that children with low levels of omega-3 fatty acids in the blood have a higher frequency of ADHD. Attention deficit disorder is the most common behavioral disorder in children. Not all children with ADHD are deficient in essential fatty acids. Statistics and studies show that a significant number of children with ADHD are. Doctors predominantly use stimulant drugs like Ritalin for attention deficit disorder, but studies show that children with ADHD and attention deficit disorder whose treatment program includes only stimulant medications continue to be at high risk for vandalism, petty crime, frequency of alcoholic intoxication, and possession of marijuana. Also, ADHD medications don't always work, have a number of harmful side effects, and never treat the cause of attention deficit disorder. With attention deficit disorder with ADHD, nutrition and food is one of the first aspects of treatment to consider as an alternative treatment for ADHD or used in conjunction with traditional treatment with stimulant medications for ADHD. Fatty acids are used to produce brain and nerve tissue in the body and are crucial for proper growth, mental function, the immune system, and brain development. The body cannot produce the two families of fatty acids, omega-3 and omega-6, on its own and must therefore receive these key nutritional ingredients for ADHD through diet and supplementation. Although the typical Western diet is high in the omega-6 fatty acid family, found in corn, sunflower, canola and safflower oil, margarine, vegetable oil, and butter, most Americans young and old are highly deficient in omega-3. Learning specialists now believe that many childhood behaviors and learning problems are associated with omega-3 deficiencies. This deficiency has a greater impact on men because their essential fatty acid requirements are, in general, much higher. Not surprisingly, boys are diagnosed with attention deficit disorder at a much higher rate than girls. Adults with ADHD and parents of children with ADHD should include foods rich in omega-3 fatty acids daily. That said, many kids just don't eat omega-3 rich salmon, mackerel, and sardines. Enter flax seeds and flax oil, food of the gods when it comes to omega-3 fatty acids.